Laser ablation for varicose veins. So the most common way and the most effective way and most durable way of treating varicose veins is endovenous laser ablation. So what is done in a typical endovenous laser ablation is, first of all, your doctor, your vascular doctor who is an expert in treating your legs should be the same person scanning your legs. You cannot get a scan in outside facility and that scan may have the correct report or the wrong report, and this person cannot operate based on that report. Your doctor should be able to perform his own scan or her own scan. Once such a scan is performed, what the doctor does is, using the scanning guidance, that means they take the ultrasound machine to the theater. Using that machine, they put a small needle into the vein, and through that they pass a wire, and over the wire they pass a laser fiber, and the laser fiber is put in the exact location where the blood is leaking. Once that position of the laser fiber is confirmed there, then what they do is they inject some little tumescent anesthesia, which is small anesthesia that prevents any pain from being felt by the patient, and then they pull out the laser fiber once they do it. This is a very simple process. It takes about 10 to 15 minutes in the right hands, and once it's done, the next minute this vein is closed and the symptomatic improvement starts almost immediately. This is a very simple procedure. This literally is a daycare procedure. All my patients go home same day afternoon with no long-term complications.